The next time you go to the doctor's office, you may not know whether or not they're affiliated with a hospital system. If they are, your bill for a routine visit may include some surprising extra charges, fees that go to the hospital even if you never stepped a foot inside it. Special correspondent Megan Thompson has our report.
In 2016, Jess Ayers and her family moved from New Jersey back to her home state of Minnesota. Ayers set about making appointments with new doctors for her 3 children, especially her daughter, who needed regular eye exams.
She was diagnosed with strabismus, which is essentially a lazy eye.
So they took her to an ophthalmology practice at this clinic in Minneapolis that had been recommended by their old doctor in New Jersey. After the checkup, Ayers was surprised to receive 2 bills, one for the physician's fee and one for hospital charges totaling $176.
It was very puzzling and frustrating.
Had you gone to a hospital?
No, we had not gone to a hospital. Right. This was a doctor's office.
Ayers discovered the doctor's office was part of a hospital system called mHealth Fairview, one of the largest health systems in the state. So Ayers, who works in healthcare communications, had to pay something called a facility fee.
I was dumbfounded because I'd never heard of it. And having worked in healthcare for a long time, I was taken aback.
She's not alone, says Christine Monahan, an expert on facility fees at Georgetown University's Center on Health Insurance Reforms.
Facility fees are particularly pernicious because they're these high, often surprising bills that are not really adequately covered by our insurance.
Monahan says hospitals have traditionally charged facility fees to help cover their overhead costs, but more and more, they're charging the fees for routine outpatient care.
2 things are at play. One is that hospitals are increasingly acquiring physician practices. More and more places you go to will be affiliated with a hospital.
In fact, between 2012 and 2024, the percentage of doctors employed by hospitals or health systems more than doubled to 55%, which helps explain why it seems more Americans are being charged.
But we're also seeing them more. Consumers are feeling them more because we're seeing deductibles increase in our insurance coverage. And so more and more you might be directly responsible.
Nationwide, insurance deductibles have increased by nearly 50% in the last decade. Jess Ayers' current insurance plan has a high deductible of $10,000 for her family of 5.
You know, there's a lot of those types of bills. They come in every which way. And it's a little bit like death by 1,000 paper cuts.
Buyer beware.
Caitlin Johnson of Minneapolis says she was prepared for a facility fee when she took her 8-year-old daughter for a panel of 40 allergy tests last summer at this mHealth Fairview clinic. But she was not prepared for how much the actual tests would cost.
The total they'd charged to insurance was $24,400.
$24,000.
Yes.
Insurance paid almost $19,000, and Johnson was left to pay more than $5,400.
I mean, what went through your head when you saw that bill?
Shocked and really confused because, part of me felt like, how did I not know that this was such an expensive test?
It turns out it's actually not.
I'm just calling to see if I can get some pricing information.
Johnson called around to allergy clinics not affiliated with hospitals and asked about a panel of tests similar to what her daughter had.
Testing typically runs about $1,827.
Could run anywhere from $800 to $1,800.
And that's the price before insurance kicks in. Johnson thought her clinic had made a mistake, but they assured her they had not, saying there is a big difference between hospital pricing and freestanding clinic pricing. So now she's fighting the bill.
This test was outrageously expensive and seemed extremely out of line.
High prices, Christine Monahan says, are another consequence of hospitals consolidating and buying up independent practices. The larger they are, the more negotiating power they have with insurance companies.
The greater the market power that a hospital has, the higher prices they charge for their services.
High procedure prices and facility fees are helping drive up the cost of hospital care, which has been growing about twice as fast as inflation and outpacing physician services and prescription drugs.
What do they pay for?
To understand what's behind the surging prices, we spoke to Molly Smith of the American Hospital Association.
First and foremost, there is no place in the healthcare system, like a hospital, we uniquely provide the highest level of care.
Smith says operating hospitals is expensive, with their round-the-clock emergency departments, top-of-the-line medical equipment, and highly trained specialists.
A patient walks into a doctor's office for routine care, and they're not using any of those hospital resources. So you can kind of understand why they would say, why am I paying for them? I'm not getting anything.
But I do think everyone needs to understand what it takes for hospitals and health systems to maintain access to care in their communities 24 hours a day. When you need your emergency department in the middle of the night, you need it to be open and available.
Smith says inflation has made it all the more expensive, and hospitals are not being reimbursed enough by insurers to cover all the costs.
Insurers, payers are squeezing providers to the point where they are no longer financially stable. For every dollar that a hospital spends on staff, on medical supplies, Medicare only reimburses them 82 cents. They have to make up that other 18 cents somewhere else.
But state legislatures are increasingly cracking down, saying that gap shouldn't be made up by raising costs for routine care.
We've seen 20 states nationwide take some type of action to regulate facility fee billing.
And when it comes to reining in prices for procedures, a bill proposed in New York State would be the first to cap prices at hospital outpatient clinics for people with commercial insurance. People like Caitlin Johnson, with her daughter's $24,000 allergy test. In a statement to PBS News Weekend, mHealth Fairview said, "We understand that healthcare billing can be complex, and we recognize that the cost of care is a significant concern for many individuals and families."
My understanding is yes,
After
there's,
8 months of
managing-
Johnson fighting her bill, and after inquiries from PBS News Weekend, mHealth Fairview finally agreed to waive her balance. They also told her they've decided to reduce their price for allergy tests by more than 80%. As for Jess Ayers, she found she could avoid the facility fee by driving her daughter to a different clinic 40 minutes away in a far-off suburb, even though it's the same doctors and health system.
You almost had to shake your head and be like, what?
Luckily, Ayers could afford to pay her bill, but she still worries about those who are less well off and about people like her parents who live in rural northern Minnesota, a 2-hour drive from their doctors.
And there's a lot of country out there, and there are a lot of people who are further from care. And if they only have a choice to go to a facility that does charge a hospital fee, what then? How is that fair?
For PBS News Weekend, I'm Megan Thompson in Edina, Minnesota.